Welcome. Thank you for joining us for today's session. I'm your host, Debbie Mathias with the Build Initiative. We'd like to begin with a land acknowledgement from Giovanna Archuleta, Assistant Secretary for the New Mexico Early Childhood Education and Care Department.
I would like to open up this meeting acknowledging our Mother Earth and the land she nurtures us with, the land where our children grow and the land that provides the food to feed them. When we talk about these resources, we must also acknowledge the lands of our tribal people and the deep spiritual and long-standing relationship of all tribal nations. Today I come from you from Nambe Awinge, the land of my ancestors who cared for it and fought for it so that I may one day live and raise my own children on it. A relationship that predates colonial contact by thousands of years. Our ancestors still speak to us and guide us through our songs, ceremonies, and writings. Through removal, trail of tears, long walks, assimilation, and the idea that by removing children would kill a culture. Our ancestors did not give up. Our tribal people are some of the most resilient people in our country, continuing to raise children to be resilient, who are nurtured through language and culture, the language and culture that cannot be removed. We must also acknowledge all other spirits who were forcefully displaced from their homelands and trafficked for labor and production on sacred native land. All of us collectively continue to experience the adversity this caused our ancestors and spirits who continue to hurt from actions done to them. Take a moment to pray these people find the healing and peace to raise their children in a world that has so many opportunities, but most importantly, create coexistence free of violence. Tribal people are praying people. This is where we are all tied. Our grandmothers and mothers continue to pray over us. And as tribal people pray, they pray for people in the north, in the east, in the south, and the west. They pray for infants, children, adults, and elders, and our non-human relations, each with knowledge to share with us. As this conference begins, I hope that each of you are balanced in all directions and take a moment to appreciate what Mother Earth has given to us and how she continues to nurture us in many ways. I invite and encourage you to learn who are the original stewards of the land you live and work on and support those nations and children of those lands. Thank you.
The Build team is so psyched we were able to reschedule this session as part of the 20 webinars in 20 days for QRIS 2020. The virtual conference goal is to explore ideas, possibilities, and learn together about how we might recreate better, more equitable systems with children, families, and early childhood professionals at the center of our efforts. We're grateful to the many individuals who took time to prepare sessions, generate content, and ideas to share. We believe the sessions will inspire you to build on these ideas, continue conversations, and innovate back in your own communities and states. We've learned a great deal as we prepared for the virtual events. One of our lessons is that a virtual event draws a much broader audience than an in-person conference. The Build QRIS conference was designed for early childhood systems leaders at the national, state, territory, tribal, nation, and community levels. Well, as registration rolled in for the virtual event, we discovered many direct service providers from teachers to center directors and home-based providers signed up for the sessions. We welcome you to our learning community and look forward to hearing your perspective. We encourage you to share your comments, ideas, and questions in the chat box. As you know, we had to pivot from our in-person conference to a virtual one. We'd like to say a very sincere thank you to our sponsors who made that switch possible. Their support's essential to this event. And now for Zoom. We've all become familiar with the Zoom platform over the past few months as we've used it to connect with family, friends, community, and colleagues. We want to point out a few features that may be new to you. First, when the PowerPoint isn't showing, you can choose your view. In the upper right-hand corner, click on Speaker View or View to see the active speaker, or click on Gallery to see everyone who has their cameras on. Next, we encourage you to provide feedback throughout the session by clicking Participants along the bottom to open the participant list, and then clicking on the icons along the bottom to share feedback or for the presenters. Don't forget to chat with us. We encourage you to be an active participant in the session. Share your experiences and questions in the chat box. There are polls in this session, so be ready. A box will pop up on your screen, and we encourage you to respond. This helps us generate more conversation and enhances our learning together. Now I'd like to turn the session over to Zelda Boyd to introduce our presenters and launch our session.
Good afternoon, everyone. I'm Zelda Boyd. I am a Senior Technical Assistant Specialist with the National Center on Early Childhood Quality Assurance. And we're excited to be here with you today. And as Debbie said, we're so happy that we had an opportunity to reschedule this session. So I am happy to introduce to you today Tracy Chestnut. Tracy is the Chief of the Ohio Department of Job and Family Services Bureau of Child Care Policy and Technical Assistance. Under her leadership, the Bureau develops policy regarding the licensing of child care centers and family child care homes. She's also responsible for Ohio's quality rating system for child care programs, which is the Step Up to Quality system. She focuses on the registration and approval of day camps, the certification of in-home aides, and the publicly funded child care program. And again, Tracy is the Chief of the Ohio Department of Job and Family Services Bureau. We also have with us Nicole Norvell, and she is the Director of the Office of Early Childhood and Out of School Learning in Indiana. In her current capacity, Nicole is responsible for the administration for the Child Care Development Fund, or CCDF, as well as Indiana's pre-K program. She's focusing also on the state's quality rating and improvement system and the licensing and monitoring of early education environments in Indiana. And then I'm really pleased to have with us also Rhonda Knowles. And Rhonda is going to bring to us today the family child care perspective of offering direct services. So Rhonda is the owner of a nationally accredited home-based program, Hide and Seek Daycare, which is located in West Haven, Connecticut. And she's a member of All Our Kin's Family Child Care Network. And for the past 10 years, or previous 10 years, she served as the co-president for one of the first home-based child care associations in the state. So Rhonda currently holds a leadership position in the union. She also serves as a on the professional development team and the contracting negotiating team with the state. So I am pleased to have with us today Tracy, Nicole, Rhonda, all bringing a very different perspective of this pandemic and its impact on family child care programs. So now that you know who we are, let's take a few moments to get to know who you are. So you're going to see a slide that comes up. And we have two questions for you. Tell us about your role in early childhood education. And then if you would scroll down once you answer that question, tell us a little bit about what's happening currently with childcare in your state. So we'll give you a few moments to do that. And we see that we have many state directors on the line, child care resource and referral agencies. We see quite a few others, and if you've selected other, please let us know in the chat box where your capacity is. We see some folks from New Haven here to support Rhonda and hear about her work in New Haven, Connecticut. We see some program coordinators, QRIS coordinators, and we are going to talk about quality today. Researchers from child care child trends, that's great. So quite a few people are in other roles other than state government and child care resource and referral. So hopefully we will have a robust conversation today as we go through. Everyone's on mute, as Debbie indicated, but please do talk with us in the chat, ask questions, make comments. We want this to be as interactive as possible. I see everyone's still answering the question. So about the current state of child care, right now, the majority of you are saying that it's open with new required health and safety precautions. And we see that across the board. A few available still only to essential workers, and some open with some new voluntary health and safety precautions. All right, as I said earlier, I am Zelda Boyd. I'm with the National Center on Early Childhood Quality Assurance. And just a little quick note about the Quality Assurance Center. Our center is funded, one, by the Administration for Children and Families, Office of Child Care, to support state and community leaders in improving the health, safety, and quality of early care and education for children from birth through school age. Our center works across early childhood sectors, including family child care, center-based programs, pre-K, Head Start, as well as early Head Start. And so we wanted to make sure that you were aware of the National Center and encourage you. We have lots of resources that we are going to be posting today. Encourage you to go out to the website and learn more about not only the National Center, but the entire National Center network. So today we hope to have an opportunity to reflect on the impact that COVID has had on the supply of family child care, not only the supply, but also the quality. So we're going to talk to our panelists about, what was the impact of the pandemic? How has it impacted quality? What are some of the things that they have done to support family child care and to support and encourage the quality to continue in family child care? We're also going to discuss and look at some potential things that we can do to recover as we go through the recovery, but also some of the things that they've done, their strategies that they've put into place as we've been in this process for now. I keep losing track, but I think it's about 8 to 10 months that we've been in this process. But they're going to talk about many things today. We're also going to be polling you throughout this process so that you can share with us the things that you're doing in your state. Okay, to set our context, as I said, most of you are probably already engaged in family child care in some way, or you are providing services or supporting family child care providers. So just to set the context today, we're just going to put up a few definitions so that we're all on the same page. So when we define family child care in our discussions, we're talking about group care that's regulated, that's listed or unlisted, is non-relative or relative care, and it's paid care. Then when we're talking about family or friend and neighbor care, we're talking about small groups, unregulated, unlisted, and can be paid or unpaid, but typically are not relatives. And then the last category or definition is relative care, which is fewer than 3 children, unregulated or unlisted, and is oftentimes unpaid. And there are additional resources that if you'd want to dig down a little deeper, we'll get to those resource slides later. A couple of things to know when we talk about family child care, we always talk about the advantages of family child care. And we know that families choose family or center-based care for various reasons. But some of the advantages that we know from research about family child care for the children are it provides a one-on-one relationship. Typically, it's a smaller group. The family child care provider can really provide more of that nurturing and responsive care. It's a family setting, which many times parents are looking for, especially for infants and toddlers. For parents, it's typically very convenient. Family child care providers are well known for being very flexible, and they oftentimes work with families' non-traditional work schedules. So whether they have to go in early or stay later on a job or work on a weekend or even have extended care, oftentimes family child care providers will step into those roles to support parents. And then parents are oftentimes looking for settings that mirror their cultural and linguistic makeup. So they want families that can speak their language and that they feel like their child is going to be really part of a family and not necessarily in larger group care. And then in the community, the advantage is that every family child care really is a small business. So that small business is paying into the tax base for that community and can be a great asset to the community. Also, there's also this sense of continuity of care. Family child care providers owning their own homes or living in the community often are starting to care for children when they're infants, and that care extends on to when children age out and go to school age. And as we know, and we may hear in the pandemic, some of those same children that were in care and at infant, toddler, and pre-K are now back in family child care settings just because of those things that the pandemic has created this kind of flow back. And then, of course, family child care providers are a social asset. Many times children, families, family child care providers they're shopping at the same grocery store, they're participating in the same civic events in their community or religious events. And so they're part of the extended family. So there are great advantages to family child care that have, again, the research is there, and we know this, and many of you that are out there and you're participating in this call today are very aware of that. But in spite of us knowing that this is an extremely important service for families, the number over the last couple of to 3 years of family child care providers has greatly declined. As you can see from these numbers here, from the period of 2014 to 2017, there's been about 25,000 family child care programs that have closed. This is a reduction of about a little over 22% of family programs has closed. And so even though families are relying on these programs, they're not being able to be sustained and continue to provide services. So we're going to talk about that today when we look at some of of course, the impact of COVID, but some of the strategies that states are putting in place. So as I said before, here are the resources and sources that you can go to if you want to dig down a little deeper and find out even more information about the trends in family child care, some of the impact, but also some of these sources have some strategies to help keep the availability and the supply of family child care available in states. Okay, before we get to our panelists, we want to hear from you once again, and we're going to talk about before the pandemic. Tell us what was happening to the supply of family child care in your state. And thinking about this block of time between 2017 and 2020, was there an increase in family child care homes? Were they staying about the same than previous years? Has there been was there a great decrease in family child care, or are you not sure? So it looks like right now, I mean, the numbers are really popping up that there was across the board a decrease in family child care, just a slight increase, maybe like 6%. But for the most part, you all are saying that it was about, wow, it's about 57% so far that you have seen a decrease in family child care homes in your state. So thanks for participating in that. Again, we're going to talk to the panelists, but we want to also hear from you when we, as we go through our discussion, we want to hear from you and your perspective as well. Okay, so let's talk about, now we're going to talk to Nicole and Tracy and Rhonda about their experience. Tell us, and I'm going to start with you, Nicole, if you would start with the state perspective. Tell us a bit about what was happening in your state prior to COVID-19.
Well, thank you, first of all, so much for inviting me to participate today. Really appreciate the opportunity. So I think, prior to COVID, we are a lot like other states, I think, certainly working on all kinds of things related to the supply of childcare, certainly in specific parts of our state where we are a little more rural and trying to think about how do we give families all kinds of options in terms of the choices that they're wanting. But we're unlike other states in that we've not seen a huge decline in family childcare. And we get asked that question a lot about why not. And, I think we believe it's because we've tried to include family childcare in all aspects of what we do. So they're involved in our quality rating and improvement system, which we call Paths to Quality, the same as any other provider. We've included them as well in our state-funded pre-K program, so they can be what we call on my way pre-K and on my way pre-K provider, just like any other setting type can be. And we think that that has been really helpful in terms of making sure that they stay a really good kind of foundational component within our system. And because of that, we've had really great success with family childcare in terms of their participation in our Paths to Quality program. So we have about 69% of family childcare homes who participate in our Paths to Quality program, which is voluntary in the state of Indiana. So that is really phenomenal. And we have a very high participation rate in our On My Way pre-K program. And that's something that really, I think, was credit to our legislature and my predecessors in our office, in which that when we rolled out On My Way pre-K, it was really important that we wanted to give families all kinds of options, meaning that if they wanted pre-K in their public school system, that was great. But if they wanted it in a family childcare environment, that we were going to make that work too. And so that has also taken a level of education for families about how pre-K can be high quality, but in a family childcare setting, and can really work for families. And we've seen great adoption for that. And so I think for us pre-COVID, we felt like we were getting good momentum on making sure that we were maintaining that supply of childcare across the state, but certainly maintaining this focus on family childcare and how do we keep them really embedded into our system, because in rural parts of our state, they really are oftentimes the only childcare that is there, and we want to be sure that we preserve that and continue to build upon that.
That is absolutely great, Nicole. And I think too, one thing that you hit on is the rural locality of family child care. If you are in very dispersed places, that oftentimes that's where family child care can thrive, because the need is great and parents don't have a lot of options. So thanks for sharing that information. And again, I want to remind our participants that please, put any questions that you have or any follow-up or comments into the chat box. And we're going to now hear from Tracy. Tracy, tell us a little bit about that licensing and professional development perspective in terms of what was happening with family child care in your state.
Sure. Good afternoon, and thank you also for asking me to speak on the panel today. So for Ohio, Zelda, you mentioned different types of providers as far as family child care goes. And for Ohio, we actually have 3 different types of regulated family child care providers. We have small family child care homes, and that provider can care for up to 6 children at one time. We have large family child care homes where there are at least 2 providers, 2 staff members, and they can care for up to 12 children at one time. And then we also have what we call in-home aides. And these are individuals who provide childcare in the home of the family. So per Ohio law, up to 6 children can be cared for in a home with no more than 3 under the age of 2 without being licensed. So we have a subset of the friend and neighbor care that you referred to earlier that we don't regulate and that we're not required to regulate in Ohio. So we don't have a way to track how many providers actually fall into that category. Prior to COVID, we licensed approximately 2,500 family child care providers and about twice as many child care centers, about around 4,100 child care centers. As far as the in-home aides go, we typically don't have more than about 20 at any given time, 20 or fewer at any given time in the state. We do have programs that operate during non-traditional hours. You mentioned earlier the convenience and the flexibility that some of the family child care providers are able to offer, more so than maybe a center environment. And in March, we had about 68% of our family child care providers that were offering non-traditional child care. For us, the non-traditional child care would be overnight and weekends. And then for state fiscal year 19, we had about 50%. So our numbers are increasing a little pre-COVID for the number of families that were receiving care during those off hours, those non-traditional hours. Ohio is one of the states that has seen a decrease in the number of family child care providers that are providing services not to the extent that is federally reported, which I think you said was 22.49%. For Ohio, it's been a 4% decrease, but any decrease is substantial, and it impacts the families and their availability to find care where they need it. So we have reached out to our federal TA partners and requested some guidance specifically on this. So we're in the middle of a very deep dive about what the family child care landscape looks like in Ohio, and looking at the end goal would be to generate some ideas on how we can improve the numbers of family child care providers in the state. Pre-COVID, I think Indiana, Nicole mentioned Path to Quality as our quality rating and improvement system. For Ohio, it's called Step Up to Quality. And pre-COVID, our Ohio law required that any program that's participating in our publicly funded child care program had also to be Step Up to Quality rated as a requirement. And that was to be done by July 1st. Again, that was pre-COVID, and the world has changed a little bit since then. And I'll talk about that as we move through. But as we were working toward this goal, we worked with our child care resource and referral agencies, our county agencies. We had providers that were assisting other providers. The state was putting extra effort, obviously, behind the effort to reach the goal. But we offered, typically, as a normal process for Step Up to Quality, we offer a 4% increase in the base rate that is provided to non-rated programs for any publicly funded child care that they offer. And then our quality rating and improvement system has 5 steps to it, 5 stars. And so depending upon where you're rated in that program, you also get an enhanced payment based on your rating. So there is a financial incentive to being rated in our quality rating and improvement system. In addition to our typical payments for providers, we also offered financial incentives. And again, this is all toward our goal for July 1st, 2020. And the most recent ones I just thought I would bring up was that we offered for currently licensed programs could receive up to $2,000 if they became rated or increase their Step Up to Quality rating with the requirement that they had to have a provider agreement, again, to serve children in publicly funded childcare to support our most vulnerable population. And we reduced our licensing fees in July of 2019. We were hearing from our provider community that was a barrier for them. So we reduced our application fee for the provider to become licensed in an effort to help increase those family child care provider numbers. And then we also instituted a very large provider recruitment effort, and there were financial incentives tied to that for family child care providers if they became licensed, and then also signed an agreement in January of this year. There was a $2,500 incentive, which helps to offset some of the costs that you incur as you're trying to set up a program. And we had quality infrastructure grants that were also part of our budget, and those were awarded, and it was a collaboration with community partners also to increase the quality of care. And then we also pay, we have a wage and retention program called Power Ohio. And so for individuals earning their CDA or their associate's degree or related field, and for time spent at your program, there's a financial incentive that's available for that. Also efforts to help us with our QRIS pre-COVID, and some of these are still ongoing, but we offered free curricula and assessments to programs that had a provider agreement to serve children in publicly funded childcare. We had Step Up to Quality fairs across the state in collaboration with our child care resource and referral agencies and county agencies, anybody that was able to help provide that support to our providers. We held a media campaign with over social media. We did rec cards, informational brochures. We also created an estimator tool that's available on our website. And it's a good way for a provider to go to the tool and say, I'm not currently rated, but I mentioned earlier that we increased the base rate for providers that are participating in Step Up to Quality. And then we also have an enhanced rate on top of that based on your star rating. This calculator helps them do the math to see, this is what I'm making now. This is what I could be making if I became Step Up to Quality rated at any of the 5 levels. So in February, 89% of Ohio's family child care providers were rated in Step Up to Quality. This was huge, huge for family child care providers. And we absolutely appreciated their hard work to become rated, and all of those people who put forth the effort to help us get there. So that's Ohio pre-COVID.
Wow, that's amazing. And I think you and Nicole both, when you talk about the resources and the incentives and the supports that are available, that definitely helps programs participate in quality efforts, but also helps sustain. One of the things you said, Tracy, is that when they indicated that the fees were too much and it was a barrier, immediately you begin to implement, and address that. And I think that's critical with family child care and any child care, but particularly family child care, to be responsive when you hear about barriers and move in very quickly to address those. So thanks for sharing that, Tracy. Okay, Rhonda, now you're a direct provider, so you're providing care. Tell us a little bit about, prior to COVID, what was happening with family child care in your state, if you can speak to that, but also in your program.
Okay, I want to thank you for inviting me to speak on the panel today. And prior to the pre-COVID, the state of Connecticut was starting to unroll a lot of programs to support the providers. We have Care for Kids, which is a subsidy that's provided to any providers that take on parents that financially cannot afford to pay, say, the fee that I charge. So they would supplement their income. All Our Kin has been awesome and fantastic, helping me become accredited for 3 years. The support has always been there. I've been with them for the past 10 years. And they have workshops for business. They have workshops for quality, for you to try and get your CDA, for you to also become a licensed provider. And the state has revamped their website from the Office of Early Childhood. And they made it more user-friendly so that you can go onto the website, and without having to maneuver through too much to find out where family child care actually is on the website, it's now more user-friendly. We also have a CDA incentive plan. We have a NAFC accredited incentive plan, and also a registry was created so that you can move up the ladder to get your associate's degree, your bachelor's, your master's, or whatever you were going to pursue. NAFC to me has played an important role in my program, because after being in the profession for 31 years, you never know everything. You can always learn something. So no matter how long you've been in this industry, you can always take something away from my union. Also, they give us Tom Copeland workshops. We have those once a year. We have regional meetings where you bring providers together that are isolated by themselves, that possibly they're not connected to a network. Networks weren't always around. 31 years ago, there were no networks. We started our network in a basement with 4 other providers. And it just grew and grew and grew over the years. And I'm pretty proud of our state. We're not quite up to running or walking, but we're crawling in the right direction to support family child care. I don't think I could have survived, and I definitely give a shout out to every provider that does this by themselves. I'm fortunate enough to have my husband as my assistant, my support system, my backup for everything I do. I commend and look up to every family child care provider in the state of Connecticut that takes on the challenges that we have on a daily basis, that you have a routine and all of a sudden it stops. A child gets sick, they fall, they need your attention. You still have to prepare food. Some of us are part of the food program. So we get a subsidy for providing nutritious meals to the children. So I think that's excellent because it helps your income, and it also tells you how to eat properly. What should you prepare so that your children aren't going to have type 2 diabetes, that they have good choices, good selections when they're getting ready to go to kindergarten. So I miss tremendously all of the meetings we had through the union where you can collaborate with your peers, you can tell them your issues, they can support you, they can give you guidance, and well, I know where to go for this, or I know where to go for that if you're having an issue. All our kin has been there. We miss them. They're part of our family, and Zoom is nice, but it's not the same as being there in person. We miss those monthly meetings. We miss them. We sit down, we have dinner together. You talk about problems, you cry together. You need a support system when you're doing this all by yourself. It's people just do not understand what it is to be that isolated by yourself and have not another grown-up to talk to. You have children all day long. This is your conversation. You find yourself in the grocery store rocking and singing songs that you were singing during the day with the children. And it's like my husband says, why are you singing Twinkle Twinkle and the Itsy Bitsy Spider? Daycare is over. And I went, well, it's just in my head. The parents depend on us. Not that centers, I give them kudos for what they do, but no one will be family childcare. We don't turn off the clock at 6. Our clock is nonstop. It goes on the weekend, it goes during the night. You're their confidant, you're their nurse, you're their therapist, you're their grandparent if there are none in the area, you're their aunt, you're their big sister. You have so many hats that you wear. You're the janitor. You wear 25 different hats, and you don't complain to anyone. They're an extension of your family, and my parents are wonderful to me. I don't have any issues with them. They treat me with respect. I don't have to worry about payments. At Christmas time, Mother's Day, birthdays, they're there. And I don't charge fees if you're late. I say, bring me a cup of coffee. And they go, not a problem. So our Office of Early Childhood is moving forward. They're bringing out and unrolling all different types of things for us as far as providing support. And I hope that the Alliance, I have to give a shout out to them as well. They have weekly meetings for us. We speak to epidemiologists. We speak to the health department. Our commissioner is available when at all possible. And we have many different speakers. So if you can get on the calls in the morning, it's great. But if not, there's a recording. You can go to it later on. So that's my perspective on family childcare. I'm licensed for 6 full-time plus 3 before and after schoolers.
Thank you, Rhonda. And I think it's really great today that we have these 3 perspectives, right? So we've got folks that are making policy, we've got folks that are ensuring that they get the services out to family childcare providers. And then you have the voice of a family childcare provider who in the chat box has a little fan base going on.
Thank you guys.
But it's great to have those perspectives, because sometimes we don't always get those voices, right? And what we can see from our 3 speakers today is that, Rhonda's talking about the need, but we see from Tracy and Nicole that there's a very concerted effort to address those needs, which are probably similar, even though Rhonda's talking about Connecticut, they're probably similar in Ohio and Indiana. And the state is listening and making those efforts so that providers can participate, stay as part of the child care supply and the child care supply chain, but also have their voice heard and have their needs met. So I'm gonna, Debbie, we have a couple of questions in the chat box that if you could help me address here. Let's see what they were. Oh, okay. So, Nicole, I think this question was for you. Did you catch this? Oh, I'm sorry. Does Indiana's QRS system provide any financial supports and incentives for family child care to help with maintaining cost of quality?
Yep, so we certainly do. So we do that in a couple of different ways. So one is we do similar to what Tracy talked about, which is kind of a tiered reimbursement based upon your quality level. So there's a base payment rate, and then a percentage is added onto that based upon your quality rating. So Tracy talked about stars. We just have different levels, levels 1 through 4, 4 being the highest. And so depending on where you fall in that, there's extra percentages added on. Because we know it is more expensive. And then if you participate in our positive quality system, then there are cash incentives or program incentives, depending upon which level you're at, that come as a part of participating in that. We also do Indiana's Teach Scholarship Program, which Family Child Care can participate in as well. So if you have staff who would like to go back and receive additional education, you can do that through scholarships that we provide with our partners at Indiana AEYC to help fund that as well. So yeah, there's lots of ways to help offset some of those costs in terms of providing quality.
We have another point in the chat box, and we've had some answers from participants respond to this. But if the panelists could respond, we need to support family child care providers that are currently in business. Do the presenters have suggestions to encourage others to enter the profession?
This is Rhonda. I think for the licensing that's in the state of Connecticut, I know when I first started years ago, there were no networks. There was no help whatsoever. We wanted to propose that when you're going to get your license through the state of Connecticut, that not only you come to the homes to inspect for lead, to inspect for your environment, to kind of give you a little, I call it psych evaluation for about 2 hours, and to make sure that you have smoke detectors and carbon dioxide detectors and fire extinguishers, which is all very important. We wanted them, when I had my association, to give out a booklet. In the booklet, it would say that we supported them. So now for me, in the booklet, which is just now going to get rolled out, the union is in it, all our kin is in it. We have several different networks and associations that are springing up in the different regions. They should have that as part of their package when they tell you you're going to get licensed. Here is your support. This is the region that you live in. This is the network or association that you can go to for help, just to talk to. If you have issues, any concerns, I think they're finally listening to us, because I think I've seen the book that was put together of all of the different networks and anyone affiliated with trying to help you run your program better, to give you business workshops. Daycare isn't just, I want to open up a daycare and I want to stay home and, make cookies and bake and take children outside and show them science. You need to know the business aspect of this. This is a business. And until people understand it's a business as well as we are early educators, there's always going to be an issue. The support needs to be there from the Office of Early Childhood. I love them. They've been doing an excellent job during the pandemic. I said, but there's still a lot more work to do. You have to speak and support your providers, or they won't succeed. The normal for this business for home-based providers, if you survive 5 years, you're doing okay. But if you don't have the support, you're not going to last 2 years. If you don't know how to price your fees to charge the parents, if you don't know that the programs are out there to have the food program, if you don't know that there's information out there, I take care of special needs children. That didn't exist 31 years ago. I found out on my own that parents really needed your support and help for special needs children. The law that was passed 5-6 years ago, it didn't exist then. So you need to support them in everything that they have. You don't want to turn away clients, but sometimes you have to because there's no experience there.
Right. Thank you, Rhonda. And I think what Rhonda is saying in a nutshell, if you don't mind me saying, Rhonda, is that you need to know that before you take the leap and any business venture, that you do have the support there, that you have tools there to help you along the way, which can be an incentive to actually think about opening a business. I'm not sure, Tracy and Nicole, if you have other things that maybe you're doing to recruit family child care providers, or any suggestions for engaging potential family child care providers?
Yeah, I would just say for us in Indiana, we recognize that we have a pretty large group of our current family child care providers who are rapidly reaching the age of retirement. So this is a topic we have been discussing a lot, which is, how do we think about this next generation of workforce coming into family child care? And so there are a couple of strategies that we are actively working on. One is really thinking about our Department of Workforce Development and those local workforce investment boards that we have in Indiana. And so in partnership with our Indiana Association for the Education of Young Children, we now have employed workforce coordinators, and their job is really to work locally with our Department of Workforce Development to think about in each community as they're devising strategies for economic development, how does childcare fit into that? And how do we think about bringing up this next generation of childcare educators? And that really is starting to be a pretty effective strategy, just because each of those local workforce investment boards have goals that they're trying to reach. And I think as our coordinators are working alongside them, it's been a great partnership to think about, how do we bring in this next generation of educators, and how do we help communities think about why childcare needs to be a part of that conversation, and why family childcare can be a really important part of their economic strategy. So that's one piece. The other piece is really then partnering with our career and technical education programs in our local high schools. And so, how do we think about, as they're offering, CTE programs, that early childhood is a part of that? And how do we kind of get folks who are in high school really thinking about early childhood as a part of their career field, and start embedding that as they are going through high school, and helping them, bridge that gap into higher education. And we've seen in some parts of our state that has been a really effective strategy. And so I think, for us, it's about how do we really engage workforce differently, so that we're not trying to independently do that, but how do we build upon some of the things that are already happening in our state, which COVID actually has been a blessing for, to be honest, because I think it has really brought to light the importance of childcare in terms of economic growth and strategy. And so, while I think we had some good momentum pre-COVID, I think we're seeing even better momentum in those strategies as we're working through kind of, being in the midst of it. But certainly I anticipate that getting even better as we move out of kind of our current economic situation.
Great. Thanks, Nicole. And that's a great segue into the next question that we have. Jen, can we go ahead and put up our next poll, which we're talking about now, moving into what was happening in your state, April 15, 2020, during the pandemic? What was happening to family child care? And I know that seems like a long time ago, but it was just a few months back. Was there no child care programs open? No child care programs were closed? Yes, you were serving essential workers only, or yes, you were serving families who were not essential workers, but a broader base of the community. So we're seeing a lot of people were serving only essential workers. And yes, some were serving both families and non-essential workers. A few were closed totally on April 15th. Okay, thank you, Jen. And one thing that we can note from this is that, and I think that some of you saw this, and I'm sure our panelists will speak to this, that even though there was lots of guidance that came out about child care facilities, oftentimes family child care was not included in that. So family child care continue to operate. So Tracy, I'm going to go to you and tell us a bit about, in the middle of the pandemic, which we were hoping was the middle, and when we got to this was going to be the end. But at that point in April, what was happening in Ohio? You know, what rules and policies were beginning to be shaped based on in a response to COVID?
Sure. So for Ohio, the state actually was shut down, and childcare was permitted to stay open as temporary pandemic childcare programs. And this included family childcare homes. So there was a process, obviously, for them to identify that they were going to continue to remain open. And they were required to follow some additional health and safety requirements. These did not include the quality standards. I know we talked about pre-COVID and where we focused it all on quality at this point in time. For the temporary pandemic childcare programs, we were focusing on safety. These programs serve the essential staff or essential families, the children of essential families, as identified by the state and with other resources as well. But childcare workers were considered essential at that point in time. And I wanted to make sure that I said that based on some of the other conversations that have taken place so far. So let's see. The ratio for family childcare was 1 staff to 6 children. And this was true for our large and our small family childcare programs. I mentioned earlier that the large family childcare homes could serve up to 12. We shrunk our ratios at this point. And this was a period from March till the end of May that the temporary pandemic childcare programs operated. We had about 50% of our family childcare homes that were operating as temporary pandemic childcare programs. So that was extremely impressive. And not as many of our childcare centers, only about 25% were operating at that point in time. So our early childhood professionals stepped up and they provided care throughout the pandemic. We couldn't have made it through that period of time without the help of those folks who were willing to take the extra steps to be in compliance with the health and safety and the assessments for health screenings and so forth that took place during that time. We had more than 24,000 children in temporary pandemic childcare programs, and 65% of those kids were eligible for publicly funded childcare. Pre-COVID, we averaged 116,000, just to give you an idea. So our numbers decreased, but our ratios decreased as part of this period. And so all of our childcare programs that I mentioned that were operating were not serving as many children. During the state shutdown, our Step Up to Quality deadline of July 1st that I mentioned previously was extended to September 1st. And we were very grateful for that because, as I mentioned, this was clearly a time that we were focusing on the health and safety of the children and getting essential workers to work to help our communities. So regular childcare did open back up on May 31st. All of those temporary pandemic childcare licenses were ended, and it was just, we were back to our regular childcare license. However, there were still reduced ratios and some different additional rules that they were following at that point in time. We tried to offer some financial support during the temporary pandemic period when those very few programs were operating. We, similar to many other states, we did a publicly funded childcare closure payment, and that was to any program that was operating pre-COVID as a publicly funded childcare program, with the hopes that that funding, if they were closed or open, would assist them in maintaining the ability to open back up once the state shutdown was no longer in place. And then, let's see. We did not require a co-payment during that temporary pandemic period either. So if you were a family that was eligible for publicly funded childcare, we didn't have a co-payment. And we paid those programs at the 5-star rating level that I mentioned earlier in our Step Up to Quality system. All of the programs got paid at the 5-star rating, the 5-star rate, based on the county location of their program. When we reopened in May, well, let me back up. We offered an increase in absent days, and we also, a family was allowed to have up to 10 absent days for 6 months, and the childcare provider could bill for those. We introduced a concept of pandemic days also, And during that May to June period of time, prior to the May to June period of time, we had pandemic days if you as a program decided to close for whatever reason. When we opened back up in May, we switched that a little bit to you could still bill if for a pandemic day, if a childcare program was required in conjunction with the health department to close, whether it was to quarantine or if it was because of cleaning or all of the above, whatever the case might be. And so we introduced that concept of pandemic days and we've carried it forward. We also increased the number of absent days that a provider could bill for a child who wasn't there. So if it turned out that a classroom got quarantined, but the whole program didn't get shut down, in the example of a child care center, then absent days could be billed for those kids in that classroom. So the provider is still getting paid because they still are having to operate that business. So we also provided pandemic support payment grants to family child care homes and to child care centers. And the grants were intended to cover the personal protective equipment, the PPE that we've all become so familiar with over the last several months. It was also to assist with additional cleaning supplies, temporary sinks if they needed to increase their hand washing access, thermometers, and other expenses. And then we also, as a state, tried really hard to support our state county agency staff, our providers, and our families. We created 2 different websites. We have a family pandemic website and a provider pandemic website with a lot of resources that we keep adding to as they become available. But we did some mental health webinars in this COVID session, this 3-month period of time for providers and families. We created a best practices training with the help of our family child care providers to see what they felt they were going to need with opening back up. That wasn't necessarily rule related. And we were really clear to make sure that best practices was not rule related. They knew the rules. They needed to know what else beyond the rule can you tell us to help us. So we tapped several different resources and then worked with our family child care providers to develop that. Technical assistance documents are out there. I think Debbie just put the link to maybe the pandemic page for providers in the chat. If not, I can find that. And then with our county agency staff, Ohio is set up a little differently, that we are state supervised but county administered. So what that means is we have people at the county level that assist us with some of the work, whether it's regulating child care providers or helping determine eligibility for publicly funded child care. And so for Ohio, our county agencies regulate our family child care homes. So our county agency staff who regulate these family child care providers, they conducted check-ins with them, and our state staff did the same with centers. But it's, you know, by telephone or email or how are you, what do you need, how's it going, for anybody that was operating with a temporary pandemic license during that March to June period that we're talking about during our COVID section. So I think here. The one last thing I think I wanted to mention is on our family pandemic page, we do have a family emergency and information toolkit that we made available to help families plan for emergencies. So there's a document that is a general family document, and then there are subsequent documents, one for each child, and it's the same template, but it helps you think through the process and have in writing, if I'm a single parent or I'm a 2-parent family, but something happens to us, who's going to take care of my kids and how are they going to know what they need to know to take care of my kids? So details about the child, their medical history, their schooling or their child care, important information, contact information, physicians, all of that kind of information, special needs for the child, maybe some likes, dislikes, whatever you think would be important is what we included in that toolkit. And that's available on our family pandemic page.
Thank you, Tracy. Again, an incredible amount of support. And I think, I mean, and we have 3 states represented here, but I know that we've heard lots of incredible stories where everybody was pivoting and doing things differently, but to really support the providers, family child care, center-based providers, and just to keep the early childhood system running during this time. And so wonderful examples, Tracy, of what you all are doing to do that. Rhonda, I'm going to shift to you to share a little bit with us about what you were doing on April 15th and in addressing the pandemic, because you continue to remain open, right? You never did close your doors.
My doors have been open since January. My parents, I felt, needed me because they were all essential workers before the pandemic. So when the state switched over to you couldn't be open unless you were supporting essential workers, it wasn't really an issue for me because my parents never wavered. They never left. Even when they were terribly afraid in the very beginning, my fees were paid every Monday morning. They didn't question it, even though they kept their children home. They said, we want to make sure our spots are secure. And we want to make sure when this calms down, which no one ever realized we're in November and we're still doing this. But they said, this is where I want my children to be. I never missed one day of my fees all the way up to November. So I'm blessed and I'm very thankful for my parents and my families. The essential workers had to go to work. They work for the VA hospital, they work for Yale, they work in doctor's offices. So they had to. And in the beginning, that was what you needed to support the essential workers that were taking care of all of the people who fell ill to this illness and this pandemic. Our state, like I agree with what Nicole said, I have to say, because of the pandemic, everyone's eyes are now awake to how important childcare is. We are a serious, important part of this economic system. You're not going to go to work anywhere unless your child is safe, nurtured, fed, loved, and you support the person who's taking care of your child so that you can do your job. Connecticut started a program called Connecticut Cares for Child Care Businesses. They gave us what is known as a Kickstart grant, which was a lump sum payment for licensed providers that were open or planning to reopen. That was a very hard decision for a lot of providers to do because the pandemic, at that time, nobody knew where this was headed. No one knew anything about it. We have pre-existing conditions. Our families have pre-existing conditions. Should we open? Should we close? It was a hard decision to make, but you took into consideration all of the health and safety memos that we received, all of the guidance that we received from the health department, from the epidemiologists. We have Yale here, 15 minutes away from me, and they were on everything. They gave us guidance and information that we trusted. And the other thing that also helped me decide to remain open is I started putting masks on myself, my family, and my children way before the state even spoke about it. We tested them, cloth, cotton, wash them, what size you need, how many do you need? They need to be washed frequently because of what you would find in the mass. So we found spaghetti, we found pieces of carrots, stuff that I don't want to mention, but we knew that they had to be, changed on a daily basis. And now, since we're here in the pandemic, I no longer want the cloth mask temporarily. I want the disposable ones because the sniffles are happening. You have to watch out if they have a cold. The weather is so odd. You're in a winter coat one day, you're in a sweatshirt, no coat another day. So a lot of the children have the sniffles. So I went online, we purchased 200 disposable masks for the children. I put them, and our law is that you put them on children that are 3 years old and above. You give them breaks, which would occur for breakfast, AM snack, lunch, PM snack, and of course, while you're sleeping. Connecticut also did a supply drive for us. We received cleaning supplies, we received gloves, we received masks for adults. They worked when they found out we needed masks for children. They went and had a drive to secure masks for the children. We were going to different designated areas in the region to pick up that supplies, which helped tremendously, but we're now running out of those items. And to try to go to Amazon, a box of gloves that cost $12, they want $30 for the same box of gloves. So we're now starting to financially see that it's not sustainable for what was given to us. You need to continue to provide those things for us. We had training subsidies, and for staff license programs, they covered the cost of first aid, medication classes, but they've now been put on hold because of the uptick that's happening. Going to have a medications or a CPR class in person, no one feels comfortable doing that, but it is offered and it is part of our training. Accreditation for NAFC support from OEC. You can take a lot of classes online, but I think now through NAFC, 45 hours have to be taken for CEU credits. That's becoming a little touchy because NAFC, mine is up in December and you can't have your observation. No one's coming out to visit you from Utah to spend 8 hours in your home to see if you pass. So things have been put on hold temporarily, and the governor has given us many waivers that we're watching. Children that normally would be attending school, they can't attend school. We just had an outbreak in our high school with 35 teachers coming down with COVID. They shut the high school down. Those parents are going to be looking for us to take in those children. We have a waiver. We can do 9, but that's it. So now you're doing distance learning. You're being thrown into things that some of us have experience in, but others do not. Providers are operating and functioning on a smartphone. You now have Google Chromebooks that people can't turn them on. They can't do the platforms. So we need technology badly. You have 5 children going to 5 different schools in 5 different grades, and you are now expected to teach that child. And then we want an adult in front of every Chromebook that's there. The teacher will ask you, where's the adult? So you're jumping from computer to computer to computer, trying to help these children with things. You didn't take Common Core math. You weren't trained to be a teacher. This isn't your job, but no one's complaining. They're doing this because their families mean a lot to them, and they're not going to turn them away. The parents have to go to work. So technology is a huge thing. We have to have the Google Chromebooks. You have to show providers the platforms that the children are going to do. You have to have time to do all of this. So when we're given challenges of, well, I'll give you additional funding, but I want a 15-page application filled out in order for you to see if you qualify. We're one person. We don't have a staff. We can't tell the teacher in the classroom in a center, I need to go fill out paperwork. You can't take another child to the bathroom. You can't stop cooking lunch. You can't stop changing a diaper to hope that you qualify for a 15-page application. If things were just simplified, we need simple. Providers aren't against quality. They're not against education. They're mostly against what you have to go through in order to achieve that. So don't make it like you're taking a law degree test. Just 2 pages, a page, 3 pages. Simplify it so that people can do this. And also a lot of providers don't have access to Wi-Fi. Everything is done on a smartphone. If you don't have an app that can go on that smartphone for me to achieve what it is you want me to do, I don't have a printer. I don't have $65 for a cartridge for that printer. I don't have Wi-Fi. Providers are now having to upgrade their Wi-Fi to try and handle all of the children that have now, instead of being before and after school, they're now in your program all day long. Your bills are going up, your electricity, your water, your grocery bills, fruits, vegetables, it's just not going, it's just a lot.
Thank you, Rhonda. And that's, it's really sobering to hear the things that you're saying, but it's the reality that we're living in at this time. And, being one person and running a business it's difficult, and so I'm hoping that as all the participants are on the call and you're in different roles, and I know that you probably have similar experiences, and, please feel free to share in the chat, but this is the reality that we're working with. This is prior to COVID. Now we have another layer on with COVID. So Rhonda, thanks for your candidness and sharing that information with us. Nicole, tell us a little bit about, at the state administrative level, what was your focus at, at the height of, well, I'm hoping it was the height of the pandemic. I hope this is just a little hiccup and we're back on the decline, but if you could share with us, Nicole.
Sure. Yeah. I mean, I think a lot of the things Rhonda said are really what we were thinking about at that time, which was, how do we help, do a couple things. So one was, how do we try to maintain some supply of childcare, understanding that at the height of stay at home, the demand wasn't as much there, but knowing that at some point it was going to be. And so how do we think about not losing the supply that we had? And the other was, how do we think about making sure that families who needed access to care had it? And so we were one of the states that we didn't close childcare at all. So you could still continue to operate. It was deemed by the governor as an essential service. So we encourage providers to serve first, children of essential workers, but certainly they could serve children beyond that if families still needed that care. We certainly saw a lot of programs that, had to make really difficult choices during stay at home because their enrollment was so low. But what we heard from them pretty quickly was just the need for funding to support, the loss of enrollment. And so we stood up fairly quickly the ability for programs to ask for funds. And to Rhonda's point, we tried to really think hard about, okay, how fast can we pay them? And as much as it seems counterintuitive at a state level that you should be able to pay people really fast, sometimes we don't have systems to pay people as fast as we would like to. So we tried to use the systems that we had so that we could pay providers every 2 weeks in a similar fashion to what they might used to be getting paid, because we knew that if we stood up like a grant and it took them 60 days to get the money to them, that likely wasn't going to be helpful. That at that point, it was going to be too late. And so we had a pretty quick and dirty application for them to fill out for us to help supplement those children that are typically coming to them where it's a private pay situation, meaning, it's not a child receiving CCDF subsidy. Because we felt like we had mechanisms in the subsidy program through increasing those kind of personal days that families get to make sure that providers got paid if children weren't attending. But what we heard from them, of course, is that's only a part of my business. It's not the whole. And they really needed help with that other side. And that's really what a lot of the grant funding that we did was for. And so at the height of that, and on that 2-week cycle, I think the biggest payment we made out in a 2-week period was about $16 million. And that was just for a 2-week period. And again, that's just for private paid children. We had a lot of family childcare homes. And I think what was so striking to our team was just in some cases, what the provider needed in order to sustain was on our side, not a lot of money, right? So sadly for Tracy and I, we deal in really big numbers that are just insane, not normal budget numbers. But when you have a family childcare provider who applies for one of those grants and all they really needed was $700, that was it, in order to stay open. I think for us, that was really impactful because as we started to make decisions during the height of stay at home, we recognized pretty quickly that, okay, listen, we really have to protect this group because, it is a little amount of money from this big budget that we have. But for them, without that, several of them communicated to us, listen, it's just me. Without this, I might lose my home. I might lose everything my family has. And so even as we moved forward and we had to start putting some parameters on some things like how much could you ask for, because eventually we knew we might run out of money, we tried to make those things still really accessible to family childcare and make it to where they could still meet all of their needs. And we kept hearing from them things like, you know, the Paycheck Protection Plan was really helpful, but some of them didn't have the right resources to even apply for that, while our funding they could get access to. And so as we moved along, we really tried to think about, you know, how do we carve out this group in our state that's really important to us and try to make sure that they continue to have access to the funding that they need. And so that was a big piece. Again, on the subsidy side, you know, similar to Tracy, we made a lot of adjustments there. So personal days, in our state, normally families have to approve those personal days in order for a provider to get paid for a pretty decent period of time. We removed that and just said, okay, if the provider enters it, we'll pay that, even if mom and dad don't go in and approve it, just because we knew sometimes they weren't seeing parents during that time and wanted to make that easier. We allowed family child care to accept additional children under our licensing regulations because we knew kids were not in school and sometimes they needed extra, you know, access to care. So there were, you know, kind of a multitude of things on the subsidy side and licensing side that we did during that time period as well. But again, I think, you know, for us, it was just super helpful that our childcare home providers were very open with us about what their needs were, because it really allowed us to understand how to make good, sound policy decisions throughout that time and this, you know, kind of time that we're in. And so I think to their credit, you know, they were not afraid to say, hey, here is what I need. And certainly we appreciate that they continue to be very open with us, because I do think it tremendously helps us to make the right choices in how we utilize the funding that we have and the policy decisions that go along with that.
Thank you, Nicole. And that's, again, it's great. And I love how you address that, you know, here you have this huge pot of money, but here's an entity that in order to stay in just needs a little sliver of that, and to make sure that you protect their interest as you're doing big corporate level type work. So I appreciate that. You guys, we are almost out of time, and we have one more question, which we were going to talk about post-COVID. So I'm going to ask our participating audience, if you would in the chat, just tell us really quickly, you can just even list one thing that you think is really critical that family child care providers will need to have in the future going forward, thinking post-COVID, if you would. So if you would chat with us in the chat box, and we're going to continue on so we can wrap up our conversation today. And what I'm going to ask our panelists to do as you all do this is I want you to think about your notes. And I know you have lots of things that you want to share, but we only have about really 5 minutes that we can spend on this. And then we want to wrap up the rest of the session. So if you could think about one thing also that you would say going forward that you learned that was critical, that needs to be in place to support family child care providers going forward to ensure that we have a good quality supply of family child care programs as we go through the rest of this pandemic and post COVID-19. If you could just share one thing with us. And Tracy, I'm going to go ahead and start with you.
Sure. I think Rhonda mentioned this already, and I'm not going to steal her thunder, but she mentioned the need for business practices. And that is something that Ohio has been focusing on. We have business practices. We've got our child care resource and referral agency staff trained in business practice training that's offered through the Office of Child Care, so that they can carry forward that business practice training to our family child care programs. What we tried to do for them, centers as well, anybody could benefit from it, but during this particular, during the post-COVID period, we've created some sample parent communications that they can use. I mean, something as simple as that to help them. It's one less thing they have to think about, one thing we could do for them, some sample parent communications that they could use to share if somebody was tested positive in their program with COVID or when they're about to reopen. So communications, in my mind, part of being able to operate your business. And so I will go with business practices, and we'll carry that forward in Ohio.
Great. And then Nicole, I'm going to go to you, and then we're going to wrap up with Rhonda.
Yeah, certainly we are focused on business practices as well. I think that's come through very loud and clear. I think the other thing that has, we always knew but probably didn't recognize enough is just that, the funding kind of components that we have being so closely tied to child attendance is problematic. And I think that's something that we knew and had not spent enough time thinking about. And so we've got a group of stakeholders now together who are thinking about, just really from a systems level perspective, how do we maybe retool the way we do some funding? Because, anytime then a child leaves, we have these problems, but certainly at this scale, when you have lots of kiddos leave, this is the challenge that we have. And so I think it's a good time for us to really just think about, how do we think about the funding from a state level perspective differently? And are there other ways to think about funding childcare and subsidy differently? Because we certainly don't want to find ourselves in this kind of place again.
Exactly. Thank you. And Rhonda, with boots on the ground and advocacy in your heart, tell us what you think is the last thing that we need to be thinking about as we move out of COVID, hopefully.
My parting words for this webinar would be, I hope that the momentum that they have right now, when the pandemic is under control, that we are not lost again, that they do not forget us again. It took a pandemic to really wake up everyone. We need them. We play a vital role in the economy, in the raising of these children. You're not born for kindergarten to 12 for the grades in school. 0 to 5 counts. They have to focus on that. They have to put more funds available to us. And I think if moving forward, they remember everything that's going on now, keep that momentum up, and please don't let us fall between the cracks again.
Thank you, Rhonda. Well said. And we're just going to skip now to our evaluation. I want to thank our panelists for a wonderful conversation. I want to thank you all that are participating. I see lots of comments coming in the chat box. Continue to do that. And I think Debbie's going to set us up for our evaluation. So thank you all for participating in today's call.
Hi, everyone. Welcome back. Boy, what a great session. Thank you so much for everything, all your thoughts and wisdom that you shared with us. What a great panel. Appreciate you so much. Okay, to our participants, before you sign off, we encourage you to give us some feedback on today's webinar. Poll questions are popping up on the screen. Let us know in the chat box what was useful, significant, or new, and how we can improve these sessions. Again, a sincere thank you to our session leaders today for the interesting and informative opportunity, and we appreciate the contributions from all of our participants in the chat box. We posted a lot of resources in the chat box, and we'll post some of those resources with the session when we post it on the QRIS NLN website. And you'll all get a link to the recording in the session today. Thank you, everyone.